Tuck the chin and extend. Man, it looks like my shoulders are kind of rounded forward. This is a really great way to kind of stretch everything in the front and to get a little bit of extension of that upper back, right? And we're going to drop our head to the right and open our arm to the right. Hey guys, Dr. Will here from Miami Spine and Performance in Hollywood, Florida. We're here at my new office and I'm here to give you guys some tips about nerve pain. So one of the most common things that I see in the office is people that feel nerve pain up in their neck and sometimes down into the arm. So typically what you'll experience is with either bringing your head side to side or turning, you'll feel like a pinch in your neck, and a lot of times they'll describe shoulder pain, upper trap pain, and things like that, even a little bit of numbness and tingling into the hand. Unfortunately, this is really, really common, and it's hard, as a patient to know what to do about it, or who do I go see, do I need an MRI, do I need surgery, totally get it, there's a lot of concerns. So I'm going to try to give you guys a little bit of clarity and show you some exercises that you can do if you're starting to feel early onset of that nerve pain. Let me just preface this by saying, if you are experiencing nerve pain, numbness, tingling, pinching in the neck, I highly advise you to go see a professional in your area, chiropractor, physical therapist, wherever you're at. Go get evaluated. Don't let something like that linger. But if it's something that you've had historically and you want some exercises to kind of complement your therapy at home, I got you. So number one is going to be the seated chin tuck. Okay, so a lot of times the initial onset of this nerve pain is from here, right? Our neck is in front of us like this. Our chin is jutted forward. So what we're going to do is we're going to sit up tall and we're going to tuck our chin straight back and push with 2 fingers. Now this is kind of a difficult movement for people to get the hang of at first because it's not something that we do. So what I always tell patients is, pretend like someone ugly is coming to kiss you, right? Chin straight back. That always seems to do the trick. So tuck the chin, and if you want extra credit, give a little push on the chin like that. Now a lot of times people will feel a little uncomfortable with this at first because again, we're used to being in this position. So our neck kind of gets comfortable in this poor posture. So when we start to put it back into a good position, it feels a little bit awkward and uncomfortable. As long as it's feeling better throughout the set, it's a good exercise. So I'm going to tuck straight back. You should be feeling a little pressure behind the head if you're doing it right. You shouldn't be feeling kind of the middle back or the upper back, but if you're really stiff, you may feel it everywhere. The second exercise is going to be a chin tuck with extension, right? So this is one of those just magical exercises that really helps resolve neck pain. So I'm going to tuck the chin and extend. Tuck and extend. Now where you want to feel this exercise is going to be right at that bump. Everybody kind of has that prominent vertebrae and where their neck and their upper back come together. That's right where you want to feel it. The number one mistake I'll see people make is they'll bend their neck back and they'll kind of crunch through the middle of their neck like this, right? So they'll be in a little bit of an uncomfortable position. You really want to tuck and drop low and extend through that, what we call in the chiropractic world, the CT junction, right? One of the most common areas that I adjust, almost everybody I end up adjusting their CT junction. So this is a really good way to just kind of complement that. And again, when you have nerve pain, a lot of times the issue is the neck itself, right? It's not always an issue of the nerve, but it's the nerve has to exit through the neck. So if the exit is no good, then you're going to end up with nerve pain, okay? The third exercise we're going to do is going to be using the foam roller here, but we're not going to be foam rolling. We're actually going to use it to get some motion in our upper back, right? So for those of you that have been here at our practice or you've been to other chiropractors, you've probably had your upper back adjusted. So this is a really, really good way to get a little bit of additional motion in that upper back. Okay, so all I'm doing is putting the foam roller between my shoulder blades, and I'm just arching over just like this. And I'm using my hands here so that I'm not straining my neck, right? I don't want you guys to be straining your neck up and down. Go ahead and cradle your head like this, drop back, and lift up. And you can find a couple of different spots, a little higher or a little bit lower, and just extend through that upper back, right? And this will help offset a little bit of that rounded, if you have a rounded posture, you look at yourself in the mirror and you're thinking, Man, it looks like my shoulders are kind of rounded forward. This is a really great way to kind of stretch everything in the front and to get a little bit of extension of that upper back. And again, guys, if you're feeling that nerve pain kind of in the pinky or towards the outside of the hand or the inside of the elbow, that could mean that your upper back is jammed up, right? Because that nerve comes out right at the lower neck and upper back. So definitely something to think about if you're starting to feel a little bit, of tingling in your pinky, or you're starting to feel any nerve pain through here or any pain in your armpit, you may need to move your upper back a little bit more. Now, the last exercise that I want to show you guys is going to be an actual nerve slider here, okay? So what we're going to do with this exercise is we're actually going to help move the nerves within the body, right? So we have 3 main nerves that come out, right? One here, one down the middle, and one through the top. And they all kind of come out the neck and through the armpit. So the first variation that we're going to do is going to be a slider, okay? So what we're going to do is we're going to start here, right? And we're going to drop our head to the right and open our arm to the right, okay? And what this is doing is it's literally going to be flossing the nerve back and forth, okay? And you may feel a little bit of tightness or tingling in the arm. As long as you've been cleared by your doctor, no problem, as long as it goes away, right? We don't want to create any type of sensation like that that lasts. We just want turn the light on, turn the light off. Now, if you're not really feeling anything with that one, or you're a little more advanced in your rehab, you can do what we call a tensioner, which is going to be here, and then the head's going to go to the opposite side. So this is putting even more stress on that nerve. But again, all we're doing is we're training the nerve, right? We're stretching and training the nerve just like any other tissue. A lot of times what happens is, since we're stuck in this position, we never kind of open up, that nerve actually gets a little bit tight. So this would be for an issue where we're actually having tightness in the nerve. Okay, guys? So again, perform those a couple times a day. We got chin tuck, we have the chin tuck with extension, we have the foam roller, thoracic spine movement, and then we've got our sliders and tensioners with the nerve. Again, guys, if you are feeling symptoms, come get assessed. We're here in Hollywood, Florida. We'd be happy to take a look at you, get you some treatment. But these are just some ways to kind of complement the therapy or prevent nerve pain if you don't have any already. Thanks for watching, guys.